Welcome to our weekly look at the top medical news and developments that could change your practice. I'm Dr. Arifa Kassaboy. I'm a practicing internist and a medical editor at Medscape and WebMD. First step, further analysis of erectile dysfunction drugs show they may not reduce the likelihood of prostate cancer, but they also don't seem to increase it either. A secondary analysis of the REDUCE trial shows the PDE type 5 inhibitors used to treat ED do not significantly affect prostate cancer risk in any subgroup of men or any grade of disease. REDUCE was an industry-supported, double-blind, multi-center trial of men aged 50 to 75 years who were randomly assigned to receive dutasteride or placebo for 4 years. All participants were required to undergo biopsies at 2 and 4 years after enrollment, which allowed uniform cancer assessments across the entire group. Results reported in 2010 show that men taking dutasteride had a 23% lower risk for prostate cancer after 4 years, compared with men receiving placebo. Now, PDE5 inhibitors are used more in North America. This new analysis looked at 6,500 of these men, 5.6% of whom were using a PDE5 inhibitor at baseline. During the study, prostate cancer was diagnosed in 19.5% of these men, compared to 22.7% of men who did not take PDE5 inhibitors. This difference was not statistically significant. Researchers believe that future studies with longer follow-up and larger study populations are warranted to determine the association between PDE5 inhibitors and prostate cancer. Our second study, the newest dietary guidelines for Americans issued by the U.S. Departments of Agriculture and Health and Human Services, are missing something this year: the long-held advice to floss your teeth. HHS and the USDA say they took the move to omit flossing after a review of 25 separate studies over the last decade failed to provide a strong argument supporting the practice. The American Dental Association is questioning why a century of success is being re-examined, saying flossing's ability to battle periodontal disease shows up over a lifetime. Federal agencies argue that by leaving flossing out of their health recommendations, they're not implying that it's not an important oral hygiene practice, but rather that its importance has not been sufficiently demonstrated in an evidence-based manner, and it should therefore not be included in the guidelines. Our third study this week shows there's mounting evidence that consuming more plant protein can help your patients counter some of their unhealthy habits. It's an observational cohort study of more than 130,000 participants in the Long-Term Nurses Health Study and the Health Professionals Follow-Up Study. Researchers found that type of protein mattered in participants with an unhealthy lifestyle. Each 3% increase in calories from plant protein was associated with a 10% lower risk of death. Conversely, each 10% increase in the proportion of calories from animal protein was associated with a 2% higher risk of death from any cause, and an 8% increased risk of death from cardiovascular disease. This was most notable with processed red meat intake, and not protein from fish or poultry. And the link between animal protein and mortality was even stronger for people who were obese, heavy drinkers, smokers, or those who did not exercise. It may be that those people with unhealthy lifestyles were already likely to have underlying conditions that could enhance the adverse effects of a high animal protein diet. The researchers acknowledged that animal protein did not affect the mortality rate of those with a healthy lifestyle. A final important study confirms that the use of patches for simple traumatic corneal abrasions is not recommended. The Cochrane Eyes and Visions Trial Register conducted a systematic review and focused on 12 studies representing 1,080 patients on 3 continents. Those receiving a patch were actually less likely to have a healed corneal abrasion after 24 hours compared with people not receiving a patch. Both groups had similar results in terms of pain, complication rates, and eye symptoms. While the authors feel more studies are needed, they concluded that patching of the eye is not useful for the treatment of simple traumatic corneal abrasions. You can find links to all of the stories from today's broadcast in the transcript below. From Medscape and WebMD, I'm Dr. Arifa Kassaboy.